And welcome back. This new news. We have a debut kind of news feature here that we're kind of excited about. TriHealth joining us now for Health Talk Live, and those are the things you're talking about in health. With me, Dr. Stephen Blatt, an infection control specialist. Good afternoon to you.
Hi, Liz.
The thing we are getting asked the most right now is these numbers are up, but our death rate's up. And we're kind of wondering why. We've got a graphic to show you. Talk to me about that.
Well, I think there are probably three reasons why the numbers are up, but the death rate's not up yet. One is it could be that the death rate is just going to lag behind the numbers. So the number of people who are infected will take them a while to get sick enough before they pass away from the virus. So that's one reason. The second reason is it's a lot of young people who are getting infected. And so those young people are less likely to have a bad outcome than the older population. And then third, it looks like most of the elderly people are being protected in nursing homes and away from the rest of the population. They've done a really good job quarantining those populations. And so those were the people who were at the highest risk.
So we're learning a little bit now about that. We should be protecting the older adults. The younger people are getting tested. So then the question is this virus getting any weaker? Is it maybe not as bad as it was originally?
No, I mean, it's still a bad virus for the elderly patients with lots of medical problems. So I think it's not becoming weaker. It's just invading a new population, younger people. We're also testing people who are asymptomatic before they go to surgery, before they come in for maybe to deliver a baby. And so some of those people we find are positive, even though they have no symptoms. So we're starting to identify some of the asymptomatic population.
Okay, other big question of the day, the thing I heard everybody talking about, we're hearing about these super spreaders, that maybe 20% of us give it to the 80% of the others or whatever. Is that true? Is it possible?
It is true. For some reason, some people shed a huge amount of this virus. So those are called super spreaders. And those people can spread it to, instead of one or two other people, they can perhaps spread it to 20 or 30 other people. The other thing that people are talking about are super spreader events, where a lot of people come together in a closed environment, maybe not wearing their masks, like in a bar, or there have been some super spreader events in churches, where a lot of cases have come out of those events.
So my guess is, final thought, you can't tell if someone's a super spreader, so it really changes nothing for us.
It doesn't change how we manage the disease, because we don't know who those people are, we don't know how to predict who they are. It's just an epidemiologic finding that certain people seem to be much more efficient at spreading the virus.
All right, Dr. Stephen Blatt, TriHealth Infection Control, thank you for being here out on our patio so we can keep our distance. And we will continue each week to talk about what you're talking about here with Health Talk Live. All right, coming up, I got to tell you, it is perfect ice cream weather. Yeah, and Grater's has a new flavor. We're going to be back to tell you about it. Coming out of the health segment, how perfect. We'll be back right after this.